So hello, everybody. Yes. Oh, no. Okay. Sorry. I had to push OK for the recording in progress, and that took me. Okay. So today I'm going to be talking about supporting attachment through kinship and foster care. And I'm hoping to provide you all with some informed care in foster care and kinship care. And we're going to go over the best practices. So exploring the best practices that we teach in infant mental health, identify some of those challenges that foster parents are facing and kinship care parents are facing, because they can be a little bit different. We're going to also explore some of the risks of removal and what that looks like at different time frames. Explore family building, what that looks like, and identify the impact of diversity in foster care and kinship care. So of course, we always start with attachment, right? Any presentation you all see from me, I know we always start with attachment, but attachment, again, is the very beginning of everything. And so it's all of those experiences summarized that we have throughout our relationships with our caretakers that become an unconscious reflex that just identifies our interaction and how we're going to interact with others. So it identifies whether we're going to come into close proximity with others or if we're going to build some of those barriers with others. And it really, our first attachments within our first 3 years help us really identify what's going to help regulate our emotions and help us cope with any type of distress or feel safe, calm, secure. And sometimes it is that distance, but sometimes it is that close proximity. So secure attachment is that close proximity, that ability to be soothed and kind of regulated with their emotions. And that's what our goal is. That's what we aim for. When you're looking at foster care and removal, there are definitely risks, but we also identify that risks become secondary when there's a child's well-being at stake. And so a lot of the times I have patients that will want me to write letters about all of the risks, and we talk about the child's well-being and where they were at that moment in time and what was their best, oh, I can't talk today, I'm sorry guys, their best option of being safe. So we really look at that and making sure that the risk removals were secondary instead of primary. And I always reassure patients that reunification is always the primary goal for most cases, especially if it's their first removal. So in most cases, reunification is the primary goal, and that's what Children's Services really look at doing. Now, again, in today's presentation, I'm going over best practices. That doesn't mean that it's always into practice across the board. And so just remembering that. Co-parenting is really important throughout placements and anytime a child is removed. And when we talk about co-parenting, a lot of the times families go to thinking about parents that are separated or parents that are divorced. But the reality is that when a child's removed, there needs to be co-parenting as well. And so with foster and biological parents, a lot of foster placements, so a lot of, and especially in West Virginia, a lot of foster placements contract out with foster care agencies. And a lot of those foster care agencies are really promoting this relationship between the foster parent and the biological parent. And this is really best practice. This has some of the best outcomes. Now, there are situations where that's not able to happen. There are safety concerns that are taken at risk. And again, the child's well-being is placed at primary concern. And so if there is a concern with that, then it's not always best practice. But for the most, it is better to co-parent that way. And the reality is I just talked with a biological mom a couple of weeks ago, and she was so upset because her child was placed in treatment with us, and she's like, they don't have behavior problems. They're 2 years old and they don't have behavior problems. And we talked about how we work on relationships more than behavior problems, and just in a preventative way. And she definitely kind of changed her tune. But her biggest concern was that her child was now calling the foster parent mom. And she was very distressed by this. And this is a very common concern amongst our foster or our biological parents. But after our discussion, we kind of talked about how the more relationships this child has in their life, the better off they are. And so we talked about the importance of building their relationship from the beginning and continuing through this through this transition and change. So it was able to shift a little bit, but she had a very difficult time co-parenting because of this. This was a barrier with that. So we had to explore that barrier, reflect it, and so that we can reconnect and move them along. So that partnership is really important. And the reality is this is the best experience for those kids. So we always keep the kids first. And so when you think about best practice, you think about child-centered foster care. And so I always, when, you know, in all the literature, it supports this, right? Whose needs are being met? When you're doing child-centered foster care, ask yourself that question. Whose needs are being met right now? If the answer is the child's, then you're absolutely right. This is the person. This is how it needs to happen. But a lot of the times that's not how we function as a society. A lot of, and not only in West Virginia, right? This is across the nation, and a lot of it has to do with not having enough support, enough workers, enough financial support, enough foster homes. So there's a lot of factors that go into why we're not always doing this. But some of the reasons to look at is, you know, if it says, you know, whose needs are being met, if it's the you know, whatever protective services involved, if it's their need because it's according to their schedule and where they can fit them in and what works best for them, then it's really not going to be best for the kid, and it's not going to have the best outcomes. Now, I know that's a huge ask to have, but it's not impossible. So really looking at that. So that's more of a system-centered foster care, right? Extended respite care in foster care is not really appropriate, right? And so extended respite care a lot of the times leads to them just having some of that respite, no real goals really incorporated, no understanding about where we're going in treatment. And so that's really not best for the child, right? So whose needs are being met? Even the parents, right? So if the parents say, I can only meet on this day, and this day, whose needs are being met? It's not the child's. We need to meet the child's needs. And so as a system, as a society, as the parents, as the foster parents, we need to adapt around the child. And that is a hard ask. Like if you think about, I think about all the foster families I work with, and trying to stay child-centered is very difficult. It's very difficult when you have a lot of different complex issues involved. So this is not an easy ask. I know it's something I preach about, but it's not easy. So this leads to informed care, and we really want to have informed care when it comes to foster and kinship care, because informed care is, you know, just kind of identifying in a preventative way what's coming next. And like we've talked about several times on here, I know I've talked with you all about the need for that safety, security, predictability to build the relationship and attachment between a child and a caregiver. Informed care helps that, right? It's that predictability, so they know what's coming next. That's really important for not only the children, but the biological parents and the foster or kinship parents, right? Everybody needs to know what's coming next. And so many times I'm working with families where they're like, I don't know when that's going to happen. I don't know. And so just sometimes, and I that's like low hanging fruit, right? If they were just a little more transparent and knew what was coming next, that could be so helpful within their process. I know, especially with a mom that I'm working with, and she's struggles with a substance use disorder, but she's been sober and doing everything she needs to. She's really progressed through her visitation with her children. But one of the things that happened early on when her kids were removed is she wasn't aware of like what was coming next. She wasn't aware of what she really needed to do. So she started doing all these things that she thought she needed to do that only kind of delayed her treatment or her treatment plan and her getting visitation. And if she just knew some of these things, and she did relapse a lot of the times early on because they weren't identifying what she was doing because it was not part of their treatment plan. And even though she was working hard, but it wasn't part of their treatment plan. So they weren't really identifying that. So she felt kind of like a failure, had relapsed a couple of times, but got back on the track of treatment. But I could just see this happening. If she just knew some of this information, she would be better off, right, moving forward. And so I think sometimes really staying informed is important. So focused attachment is definitely a risk of removal. And so focused attachment occurs between 7 and 9 months old. And some of the risks that take place is prior to the 7-month-old. So 6 months or earlier, the risks that you come across is that they attach to the foster parents before their primary biological caregivers, right? You come across that they've already developed a preferred provider. So around 4 months old, infants start to identify their preferred caregiver, so who they want to respond to. And we talked about this, I think, our last time, about how a lot of the times that's the mother, because many of the times the mother's the primary caregiver, but this is where they prefer their caregiver. And so this has been disrupted now, and any type of distress can disrupt that relationship. And so those are the risks that we face in earlier than 6 months. Now, if you look at later than 9 months, some of the risk factors you come across is the disruption in the already attached relationship. So you already have a formulated relationship with the caregiver, regardless of what type of attachment it is attachment. And you run into the risk of that becoming disrupted. And anytime there's a threat to their survival, right, that's their fear cues that are kind of sprung. And so then they become disrupted in other relationships in their lives. So you have to work really hard at rebuilding relationships. And trusting adult figures, right? So if they've already built that early on attachment and it's become disrupted and now they can't trust those significant adults in their lives, what adults can they trust? And so this definitely disrupts attachment. When we're looking at visitation, there are definitely influencing factors on visitation. So especially with young ones, best practice is frequency of visitation. Now, sometimes this gets confused when I teach this. We talk about the difference of, when you're looking at foster and kinship care versus like parents that are separated or divorced. There is a difference because that relationship is different, right? A removal is almost like a trauma. And so if you have parents that are separated or divorced, sometimes the frequency of visits aren't an influencing factor on visitation. And so that's not across the board, right? The literature does identify with like divorced or separated parents, it's not even the frequency of visit, but it's the quality of the visits when they have them, so not as often. Now with removals, it's the frequency of visits, so it's reminding that caregiver is there and rebuilding those relationships so that these other relationships that are being introduced in their lives can still be formulated as they're identified with visiting these other relationships in their lives. Definitely the nature of the parent-child relationship prior to placement, especially if they had a close relationship, a close bond. You want to identify that, and when taking into consideration of visitation. Neglect, if there has been neglect, you want to take that into consideration because you can have behaviors around that. You can start to identify some safety and security issues that come out within the child. And so you want to approach them a little bit differently and helping them feel safe and secure and transitioning from one to the next. If there's been role reversal, many of the times when children are removed from their home, you can have like a parentified child. So a child that was in charge of their siblings or even their caregivers. And so a lot of the times those role reversals are different. And then you have role reversals, especially in kinship care, right? So if you have a child going into kinship care with a grandparent, now that role is reversed. And so they're almost like a primary caregiver or a parent. And so there's some role reversal there. So in a parallel process across the board, there can be some tough transitions when it comes to visitation during that. And it can cause some disruption in the visitation. And so there may need some to rebuild and repair during those visitations. And so that's really important to kind of look at. Traumatic events, what their ACEs are, what kind of adverse childhood experiences they were exposed to or had experienced, what this removal was like on them. And so really identifying the signs of stress in those dynamics as well. The presence of kinship or foster attachments. Many of the times during visitation, kids can find it very confusing when they have those other caregivers there. Sometimes there can be conflict. That's why it's really important to open up those relationships and partnering together and building those co-parenting pieces, because we want to make those visitations as less awkward as possible. And naturally, the first couple are definitely awkward. I had one mom that was going towards visitation and she was super stressed. And this mom was like so amazing about putting the child first and meeting the child's needs, but very stressed in leaving the situation, because at first she had to leave the situation because there was conflict between the two. But she started partnering and building that relationship because she noticed it was what was best for the child. And she did amazing. The child did amazing too, but the first couple were very stressful. And so mom was very stressed by that too. But they worked through it and they were able to partner and work together. And so that was, it's not always happy endings, but I like to share those ones because there are a lot. Best practice for visitation with informed care is parents progressing in treatment. We want to see the parents, the biological parents, progressing in treatment. We want their treatment goals to be clear and transparent, right? Everybody should know the parents' treatment goals. The parents should know it. The foster parents should know it. Support system should know it. The court system should know it. So everybody should be on the same page of what those goals are and how that parent is progressing with them, because that's really important. Parents need to see that they're doing well. They need those compliments. You know, having their child removed is huge to them. And it can be a huge failure in some of their eyes. And so it's really important for them to see that they're progressing towards that and building them up. Supports is huge. I can't tell you how big support systems are for parents and for children who have been removed. And so for both, a lot of the times we wrap around the child and we, you know, because especially when their well-being, take a breath, when their well-being is in question. And so we definitely wrap around them to make sure that they're safe and secure, but we want to remember to do the same for the parents as well. I had one mom working, it was kinship care. Her children were placed with her mom, and being placed with her mom, she had nowhere to go. She was in a domestically violent situation. She had to leave that significant other and find a place to stay. And she had nowhere because her mother was her support. And so she wasn't allowed to go there with the kids. And so she went without supports for a very long time. And she fought through and was very successful. But I'll be honest, watching some of the barriers she's come across, like, I don't know that I could have done it without that major support system. And so remembering that we need to provide supports for the parents as well. This is one that I think we don't always think about, right? So well-designed weekly plans. A lot of my biological parents that I work with and foster parents that we work with their weekly plans. Like, what does your visitation look like? What do you imagine? Because when biological parents go to get their visitation back, they're just so excited to see their children and so happy that they get this visitation that they don't think about that next step, right? This is just like an over amount of joy. And so we talk about this being a war and that they're winning these little battles. And so we have to look at what's going to be the next battle. Let's look at what we can anticipate our next battle to be. And a lot of the times when they start visitation, it's about leaving their child there or leaving their child with the foster parent. So we talk about how to manage their emotions around that and how to appropriately prepare their children for that. And a lot of the times we're working with CPS with that. Like, what are they allowed to say? What are they not allowed to say? How can we help them with this? And how can we help the children, right? And so preparing for that in advance is completely beneficial for the child and for everybody else involved. And so it's, you know, having those well-designed weekly plans, even sometimes our plans are even what they're going to do and what they're going to plan, especially when we have two involved. We have a foster mom now who, she did an amazing job, but she wanted her foster kids to remember her. And so she knew that these visitations were getting closer to them going back with their biological parents. And so she went in and they developed a photo album of the foster child and her foster family with the biological mom, right? And so the biological mom helped them so that the child could see that, like, this is all okay. We're partners, we're working together. But this was well planned. So this was a weekly plan that they did. This was an activity. Some of my biological families need ideas, like, what can we do? What can we bring? Can we bring toys? Because if they're not allowed to bring toys and they're going to a room with nothing in it, that can be a long visitation, and it can get rough pretty quick if you have little ones. And so we talk about ways to plan for that, or plan activities with the foster parents or without them. So we talk about this in detail. As the treatment plan's completed, visitation should be increasing. And so many times we see this being a struggle for biological parents, right? So they meet some of the goals and they don't see a change in visitation and they're not sure what's going on and they can't get a hold of anybody. So we're really working, I know we're working at WVU Medicine to really increase some of this collaboration and kind of working to advocate for parents and for foster parents. Because I think on both ends get frustrated. And so we just want to work with this. And we know the system is overwhelmed. And so it's a lot. We have a lot of kids in placement today. So, and that the visit increase is consistent. So whatever we're doing, making sure that it's consistent. Again, that predictability is so very important. So supporting kinship and foster care, we want to make sure that we're establishing that attachment. We're helping maintain attachment. We can help foster parents and kinship parents kind of identify some emotional cues and relational needs that they might have. Identifying miscues, right? So a lot of the times kids will act out of stress or frustration or just scared to attach at times. And so we talk about that and where some of those miscues are coming from, and trauma triggers. If they've had trauma, identifying some of those triggers and seeing some of those patterns and helping sometimes the kinship parents or foster care parents identify where some of those triggers are. And you know, I think the foster care system and kinship care system does a great job with education. And CPS does a great job of requiring some of that education and putting it in place. And so we do provide a lot of education and exploring some of that. Talking about techniques to build attachment. So we talk about responding to physical and social emotional needs is number one, right? We know that that's going to build attachment. Reflecting that two-way communication, helping kids, even if we don't know the answers, helping them understand that we hear them, right? We hear them and we're not sure of that answer right now. And so just being very clear about that and transparent can be very refreshing to a kid and build on that attachment. Verbalizing actions and attention and what the intent is. Many of the times kids are very on guard. We talk about kids who have had disruption in their life, having some of that hypervigilance, right? Hypersensitivity. And so just verbalizing what we're doing next, what our intentions are. We're going to go here to do this so that we're going to go visit your parents at this place so that you're able to have that and build that relationship. And we want you to enjoy your time, right? So verbalizing some of those things. Providing a routine, right? Routines, again, ensure that safety, security, predictability. Anticipating that there are going to be power struggles, right? That's part of this little battle, is that there's going to definitely be power struggles, especially when they come back from a visitation or going towards a visitation, right? Some anxiety builds up, especially in younger kids. I've had a lot of foster parents working with me that say, you know, there's such power struggles when they come back from visitation. So it really upsets me because, you know, clearly there's been some sort of neglect or abuse. Clearly something is going on. Not always, right? That's a sign of stress. Those power struggles are a sign of stress. Going from relationship and being removed from your house is stress within itself. And so there's not always something else going on. There are times where there are, and we can clearly identify some of those patterns and some of those triggers, but not always. And so we talk about that. We talk about the sign of stress and not jumping to conclusions, because sometimes our minds can go further, but staying present and in the here and now. Setting clear limits, right? Those clear limits and those clear boundaries definitely help with that predictability. Staying calm when a child is upset or a baby is upset is important. I work with a lot of moms who struggle with a substance use disorder. And so we work with reflective practice on how to stay calm, regulating our emotions, checking in with self, so that they can stay emotionally available for their child. So allowing themselves to stay emotionally available for their child. And when their child rejects them or pushes away or needs a little bit of change in scenery, allowing them to separate, but being ready for them to come back. And so the emotional distress that can come along with that is great, because many parents hold guilt of losing their children to begin with. And so we just want to kind of teach that circle of security. Take an adult time out. That goes back to checking in with self and cognitively kind of reflecting. So that's an important piece. Working on recovery, whatever recovery it might be, substance use disorder, mental health, just recovery within themselves of how to recover from this. And so working on recovery altogether. Sensory nourishment, right? And so a lot of my work too is working with moms who have infants that have been taken away. And so we talk about, like I said, I had one mom she was so funny because we would work and she would get so mad at herself because when she'd go on visitation, she would, her natural mother instinct was to search that baby head to toe for any type of bruises, sores, scratches, anything, right? She wants to know that her baby is being taken care of in this foster home. This is where that co-parenting and partnership would be so much better, right? It'd be so healing if she was able to have that. But she didn't. So she didn't know what kind of home this baby was in. And so she would take all of that time to search them. And literally she became obsessed with it. And it would take her like a half hour to search through the baby and to look at signs of distress. And so we talked about ways to just provide sensory nourishment. Okay, if you have to check out the baby, let's massage their legs, right? Let's rub their feet and hands, and let's build that relationship as you're doing this, and try to calm yourself down too, right? The baby can feel that. And we don't want every time this interaction happens with you for the baby to feel that distress, right? Because then the baby's going to start pushing away from you, and that's the last thing she wants. So really reflecting on this and teaching her some of those cues and how to respond to that is important. Acknowledging and expressing emotions, managing overflow of emotions and overwhelming. Like I said, the first time parents sometimes get visitation, their emotions are just overwhelmed. Same thing with foster parents too. The first time foster parents get that foster kids have visitation, their emotions are overwhelmed. I had one foster mom I worked with, and she's like, oh my gosh, we were doing parent-child interaction therapy, and a lot of the times we'll do it with the foster parent and the parent. And so it's a smooth transition, right? They're all using the same language, the same behaviors, the same interactions. So then it becomes a smoother transition. And she was like, so the one session, the child was not there. And I said, is everything okay? This was a session with you and the child. And she's like, I can't. If I start playing, I'm going to cry. I'm so nervous about tomorrow. This is their first visitation. I just want it to go well. And what if it doesn't? And it has been so long. And this foster mom was totally invested, right? And so very nervous about it. It was her first foster placement. And so we just kind of had to work with some of those emotions and her controlling her emotions, because she didn't want to cry in front of the kid and she didn't want to be upset. She wanted it to be good. And so this was all child-centered, right? It's what we want. Whose needs are being met? We want the child's needs to be met, right? A lot of foster parents is the system. We've talked about a lot of barriers we can come across with the system. Accessing biological parents. Sometimes they don't have access to biological parents, or biological parents don't want to meet them, right? I have one family that I'm working with that it was that the biological family did not want to meet the foster family. The foster family wanted to do this therapy together. The judge had to court order it, and then they built a partnership. But there was just such a barrier there, and for no reason, right? Some of their own thoughts and their own monsters that they created. And once they were able to overcome that barrier, they actually became friends. And so it was ideal, but it's hard, and it's a shame it came down to the judge kind of mandating that. Accessing information. Foster care parents have a really difficult time accessing information. So it can be hard identifying trauma triggers or what their experiences were like, because they don't have all of that information. And sometimes it's for better reasons, but sometimes we could allow some of that information to help with some of these behaviors. Consistency in CPS workers. So, we talk about how this system is very overwhelmed and overburdened, and we do have CPS workers that have triple their caseloads of what the national regulation is. I was working with a foster or a CPS worker one time, and in one of my classes, and I can't remember. I think the national regulation was like 19 cases, and she had 35. And I was like, man, how are you going to meet all those needs, right? And so while we sometimes can get frustrated with the workers, it's not really the workers, it's the system as a whole that kind of needs restructured. Uncertainty. So uncertainty of what will happen. A lot of the times foster parents are geared towards fostering to lead towards adoption, but that's not always the case. We just had a judge tell foster parents, the family was getting the kids back, and And the judge told the foster parents, you are a foster home. Like we are going for reunification. And so I think sometimes that gets lost in the uncertainty of it too. So those plans for transitions are important, and kind of understanding that is really important too, and going into it. A lot of the times we have those conversations with foster parents, like what brings them into fostering, what do they like about it, how do they manage it, how do they manage when the kids are gone. I had one woman that I worked with in the NICU. Actually, she came in, the child was removed and the parents were no longer allowed to come visit the baby, and the foster parent just picked right up, and she had done this for like 28 years, and her stories were amazing. I could have sat there and listened to her all day. She was just telling me some of her stories, but her stories were amazing, and she was okay with that. She knew the transition, she knew that she was temporary, and she was okay with loving these babies for the temporary time and giving these babies back. And so she was pretty amazing with that. I don't know that I could do that. Now we know 29% of children in an out-of-home placement are cared for by relatives. So a lot of the times, children are placed in kinship care, and kinship care can be a tough transition with itself. Some of the challenges are definitely the role transition, right? So you're moving from sometimes an aunt to a primary caregiver, a grandparent to a primary caregiver, a sibling to a primary caregiver, and that can be a difficult role transition. That's a loss of a role, right? So it's the loss of being an aunt to now a primary caregiver, and you miss some of that relationship, and the child does too, right? So the child moves to having a different relationship too. Sometimes there are definitely loyalty conflicts, and I see this a lot with the grandparents. I see this as, them getting blamed for stealing their children, and really, really other, it could be aunts and uncles too, and cousins, and so I guess I see it across the board, but for the most, I think I see it with grandparents. But sacrificing relatives, right? So like placing them in this position where they have to, they're kind of left with that. And I come across a lot of family members like that too, that really struggle with that. I see grandparents and cousins and aunts and uncles that tell me, we were just kind of thrown into this. We didn't want this child to be placed in the system, so we took this child, and they didn't really have that time to transition, and so that becomes a difficult challenge for them. I had one family I worked with, and they did amazing. It was kinship care with the grandparents, and the mother was coming in to build a relationship, and the mother had ended up relapsing, and this was her last chance by the court. So it wasn't the first time that she had relapsed and gone into active addiction during the reunification process. So now they were looking at terminating her rights, and the grandparents were like, I don't know if I want that. They said, I want to be their grandparent. Like, I don't want to be this child's parents. And so they worked with a foster agency or an adoption agency of parents that wanted to adopt, and they picked out a set of parents that were willing to have them involved as grandparents. And they worked really hard. I mean, we worked for probably 6 months on just the decision of this. And then they made that decision to just stay the grandparents. And this was a really difficult decision for them. And needless to say, their daughter was very upset with them, but this was a hard decision for them. And really it was great for the kid because he had all these great relationships in his life. And so I don't want to say great because I'm sure he misses that relationship with his mother, but he was still able to keep that relationship with his grandparents. So those generational ghosts that kind of come up, right? So that intergenerational trauma that can repeat some patterns, and especially when you're working with kinship care. I had a family that the grandparent had adopted the children, and the grandparent actually lost her children to CPS when her children were younger. And so there was a lot of stipulations around when she first started fostering the kids and then adopting the kids, but she did move towards adopting. And at one point they weren't going to allow her to adopt because of her history, but because it was so long, and she did a great job. She was great with the kids. I mean, you could tell that she had a little bit of a rough past, but she was great with the kids. And so they allowed it to happen. But it did take a long time. But, those ghosts came up for her when they were questioning it. She was like, I did do wrong. And she talked and was able to process it. And so she, her daughter unfortunately repeated those patterns. And so it did create problems, and it did create a lot of emotions for both of them around it. And attachment ambivalence, right? So there's a lot of ambivalence sometimes around kinship care and getting attached to these kids, and even foster care, right? Is this an avenue for adoption? Is there going to be reunification? It's all of this uncertainty that kind of creates this ambivalence in building these relationships with kids, and sometimes purposely not attaching to kids. And I see that sometimes when some parent, kinship care and even in foster care, where they're saying the guardians are saying that, they just kind of kept a distance because they didn't want to get too attached. They knew this child was going to go back, right? So really some ambivalence about creating that attachment. And so working on that can be beneficial for the child too. What kind of feelings are felt around this? Like tons of different feelings, right? Grief, loss, shattered hopes and dreams if they had kind of put on wanting to adopt, making tough decisions around what they want to do for these children and what they want to do for themselves, love, that vulnerability. So there's all kind of emotions around that. Family building. So again, we're child focused, focusing on the child's needs, making sure that there's positive support, positive parenting, consistency, being trauma informed, making sure that, and like I said, I think our system does a great job of that. I think foster parents, kinship parents are educated greatly on some of this information. I think interactions would be great to increase some education there, but they do try to provide as much support as possible in the limited resources they might have, but consistency is important, and self-care. So I always talk with, especially I had one aunt that was coming and she had adopted her nephew, and she talked a lot about that. Well, it took her a while, and then it kind of surfaced that, she said, this happened overnight. She said, I thought about when I get pregnant, what that'll be like. And I start thinking about those things. She said, I didn't have time to think about any of that. I just had to take him or not. And she said, and my mom kind of pressured me. And so she was feeling a little bit of guilt around that. But we talked about like what her lifestyle was like before that. I mean, she'd go out with her friends, she'd party, she'd go shopping, right? And she's like, now I have a kid and I can't do any of that. And she was so overwhelmed with that. So we talked about self-care and the importance of still doing those things that made her her, and what was healthy for her. And so finding that balance, I always talk with parents, biological parents, foster parents, kinship care, doesn't matter. Self-care is huge when you're parenting. You're not able to take care of other little people if you can't take care of yourself, right? And so self-care is huge. A lot of what I had went over and talked about and come from a lot of these resources. I know I've shared this with you guys over and over again, but if you've not visited some of these sites, please do. There are tons of resources, tons of educational opportunities. They provide different trainings, free trainings. The NCTSN provides some free trainings. They're amazing. 0 to 3, same thing. If you go in there, tons on foster care, building those relationships, building the relationships from a distance, how to attach from a distance. They talk about even incarcerated parents, parents who are in the military. So how to really facilitate and build those relationships from a distance, and really work on some reflective pieces, which is what we work on in infant mental health, is really reflective pieces so that you're emotionally available for your children when you're with them. So just want to touch on diversity in foster care, because this is really huge. I don't think we realize what a big issue this is sometimes, but it really is. It really is kind of disproportionated when we look at culturally what children are in foster care and what foster parents are available. And so 42% of children in foster care are white, 56% of children in foster care are non-white. And so some of the complications we come across with that is that we don't have available families that are culturally available for them, right? And so a lot of the times, they're stuck with families that love them, but don't understand their culture, or can't relate to their culture, or can't help them kind of relate to their culture. And so we kind of have a gap there. There's implicit biases. So one's own beliefs. So a lot of the times the foster parent's own belief, their trajectory can be impacted by this, especially if there are strong cultural ties within their family, and lack of education across the board. I think this is probably one area that we could educate foster families a lot more on. I had one I had one foster family that was pretty amazing with this, and they had a little Indian child, and they weren't sure of how to integrate some of their culture. And so they really did a lot of research. They found a mentor, right? So somebody that could help mentor them on the lifestyle and what their cultural beliefs are and how they could resonate with them. A lot of significant religious cultural beliefs of, of fasting and things around that. Like, and these kids, the little girl was older, she was 11, and so she had some idea of what those cultural beliefs were. And there was a little baby too, but the girl really started to feel guilty about not meeting her cultural need. And so that was like heartbreaking. So this family did amazing with it. This foster family did amazing with it, and finding they really went above and beyond. And I will say I'm very grateful, because I work with a lot of foster families that go above and beyond. I know we hear real horror stories about what happens with kids in placement and going back and forth, and don't get me wrong, I definitely experienced some of that too. But I have some amazing foster families that I just feel like would be like fabulous if they continue. So interventions needed, making sure that we're providing assessments, direct supports, screenings, behavioral interventions. So these are the top two that we teach in infant mental health that are really beneficial when there's removal of a child, especially when we're looking at within the first year. So trust-based relational intervention. And ABC, you guys have heard me talk about attachment, biobehavioral catch-up. And a lot of this is the dyad and working on building that relationship and overcoming some, a little bit of trauma with that. And I'm going to show you guys this video. It's pretty long. Hopefully, I hope we get through it. But I think I might have showed this before. It has such an impact. It is long, but it has an impact. So I really want to be able to show it. But I wanted to let you guys know too. I was recently at a not recently. I always lose a year with COVID, so it was really like 2 years ago. I went to this training and they talked about foster care, and there was this program, and I can't remember what it was. I meant to look it up this morning. But there was this foster program, and I asked them specifically if they had any in West Virginia, and they said no, they couldn't find any foster parents. But there's this foster care program that really built that relationship. And these people built a relationship so greatly that this foster parent, this mother was not allowed to visit her children. This foster parent worked to send her letters that said, okay, I'm this age and today I did this, this, and this, right? Letting them know what their kids are doing, where their development is, how it's going. And it just built, they would meet for coffee, even when she wasn't allowed to see her child. The foster mom would meet separately without the child, and they would meet for coffee and talk about the child. This created such a connection and relationship that when that child was placed back into this home, they stayed as friends, and this child would go and stay on the weekends every now and then with his family. Like, I'm just thinking, like, I get cold chills. Like, imagine what that does for this child. Like, imagine the relationships in this child's life and how easy it would be for them to overcome some of this adversity in their lives. I just wanted to share that. Okay, I'll let you guys speak. Can you guys hear this?
It's kind of tough to hear. I don't think I hear anything right now, though.
I don't either. Hold on.
Let me see if I can share sound. Yes. Okay. Let me try again.
I want to talk with you about what it feels like getting ready to be adopted. When you're a little kid who's already had about 100 mothers. kids like me, see, don't have families of our own. Because there's something wrong about us. Some people say that my first parents shook me until my eyeballs got loosened up. Or they left me alone. Or they gave me away. Or they just ran away.
The truth is, I can't do any of these things. I can't forget. Even when my brain does, my body won't. Did you think I was supposed to just be sweet and adorable and ready to connect to yet another family who were going to throw me away?
Could you have done that? And so now, I won't let you imagine, even for a minute, that I like you, that I need you desperately, that I might ever grow to trust you. I'm not stupid. I was not blind.
I agree it doesn't make much sense for me to join in with all the other people that have hurt me by hurting myself. But I do it anyway.
Am I safe with anybody? Doesn't matter anymore.
Do you honestly think I'm going to say, "Oh, I get it. You were just kidding all those other times, but this time you really mean it"?
And so, do you want to hear something funny?
Okay, I have to stop it. I'm sorry, guys. I know I didn't allow enough time to end that, but it is a long video, but I think you can all see. I mean, they just talk a little bit more about some of the indicators that happen after permanent placement occurs. And just in the end of the video, they talk about just, being patient and remembering that they need help and they need to feel safe and secure. And I think that's an important piece, right? When we talk about best practice of kinship care and foster care, we think of sometimes what we're lacking within the system, but just remembering that it does help keep kids safe, and that's the primary goal. And it does help with some secure attachments. Like I said, I've great experiences with amazing families, and so we still have that capability to do that. And so, any questions about? And I know I didn't leave very much time. I wanted you guys to see that video, but.
Amanda, that was really lovely, but also very emotional. But I thank you for sharing it. My question for you, and I don't know that this is an easy one, because I know these conversations take a lot of time and a lot of working through, but we often see these kids show up in the emergency room with sort of abandonment in the emergency room by their foster care parents, sort of demanding hospitalization or new placements, and it's often a very difficult time for both the child and often the foster parent will disappear or may be there. I guess my question is there any, other than hours and hours of conversation, which often we don't have, are there any easy, already put together resources that we could hand some of these parents to sort of, while they're sitting there literally waiting for hours, help them sort of learn? I mean, that video was very powerful to sort of help them understand that these behaviors are often the results of this. I often say these things to people, but it is an inability to have like the mentation of the child's perspective is largely and almost always missing in those events, and it is very difficult. I know there's no easy answer, but I wondered if there was easy resources that are already put together that existed in the world.
Not that I know of. I mean, there's a couple books that I read, but it wouldn't help parents. And so like, not that I know of, but the NCTSN, their website, I'm gonna make it a task to venture through and find one for you, because I bet that they do have one. I think that the complication with that is that you know, a lot of the times attachment issues don't come out diagnosed, right? And so if it's reactive attachment disorder, then it's one thing, but if it's not attachment issues, then it doesn't come out diagnosed. So then parents separate that in their minds with the diagnoses. But I will say that when I have parents that read some of our flyers out in our waiting room, they're like, this makes so much sense. So I agree with you. I think it would be really beneficial if we had this, because separating kids who already have attachment issues is not the answer, but it is very overwhelming when you have a parent dealing with it all the time. Yeah.
That would be really great. As I said, they will sit for hours, and sometimes some of them are more aware than others, but it's a rich opportunity sometimes to have them reading things and being thoughtful about things. And
I'm gonna look, and I will do a follow-up the next one. So that'll make me look.
Yeah, that would be awesome, Amanda. If you have any resources you want to send my way, I'm happy to distribute them as well.
Okay.
We are at 1 p.m. Any final questions? I don't want to rush anyone. And that was, Amanda, amazing. The word that comes to mind is powerful, and such humbling and incredible work that you do. So thank you for sharing that with us. But any final thoughts or questions from the group? Dr. Willard, I see you unmuted.
Amanda, that was wonderful. I've been doing a lot more work kind of in this realm, but on the parent side and parental fitness evaluations, and you know, really kind of it's a new area and a struggle for me. And so I hear the foster care stories, and you know, I'm just like, I wish everyone could come see Amanda. Can I just refer all these like parents to Amanda? It's like to get the services and the attachment, because I don't know, maybe it's my perspective, but I'm finding DHHR wanting to terminate parental rights when I still think there's a chance.
Yeah.
And I just keep writing like, no, I think their parenting is adequate. I think this is going to be okay if you give them X services. That you can't just remove the kid and then say, like, did you complete X, Y, and Z? Like, you have to help them. I had a recent one. Have you worked with any teenage mothers? And like this issue of, so the teenager gets pregnant. And so then the teenager gets removed from her parents' home because their supervision wasn't appropriate because she got pregnant. And now she's both a foster kid and a foster parent, or a foster kid and a parent. And then there's all these dynamics of people just wanting to say like, she should lose her rights because she's a teenager.
Yes.
How do you work with all that?
Oh, I had like 3 cases like that back where I used to work, and I'll tell you where my primary patient was the teenage girl, and she had, you know, and so I think it really disenables them from making some choices and making healthy choices on their own and the choices they want to make, and I think that they need a lot of support, and so yeah, I don't have like an answer for that, but it's hard, and there are so many dynamics, right? And we just actually hired for our pregnancy and postpartum, but we're hoping to expand this position with some grant funding. It's the Family Urgent Response Coordinator, and their job is to advocate for these parents in the realm of the court system and with CPS, and show them and display everything they're doing, because I do see that a lot. And it's easy, and my intern this week got to see that with one of our families where we met with just the foster parent for so long, and it's so easy to villainize the biological family. Then we met the biological family, and she's like, oh man, they're going through so much. And I said, right. I said, it's so easy when you hear one side of the story to villainize the other one. I said, but the reality is you have two great families that really just want the best for this kid. And so how do we pull them together?
That's wonderful. Thank you.
Sorry, I didn't really answer your question, but
I don't think there is an answer. It was just so hard to like conceptualize how to deal with this. And then I just kept getting frustrated, because I also think we put sometimes an unfair expectation on parents that they have to be perfect. And I'm like, wait a second.
yeah,
You're getting upset because she got frustrated that the newborn was crying, but she's 14 and she's learning to control her emotions. And I get frustrated with my kid, and I'm just like, yeah, we gotta step back and make sure we're being realistic in some ways and helping these kids.
Yeah. And support the families. I agree. I feel like we need more support. And like, I do think we do a great job of education, but I think we need support along with it. So
Always need more resources.
yes, we do.
But that emergency urgent, what did you call the new
Family
position?
Urgent Response Coordinator. Yeah.
So that'll just be like Mon County.
So that's within just Chestnut Ridge.
Oh, okay. Baby steps.
Yep, baby steps. We're hoping it could grow and go further, but that's just within our patients right now. Yeah.
That's incredible. No, thank you so much. And Dr. Willard, great point. I didn't even think of that when the foster child has a baby. And Amanda, so many different points in your presentation as well. I didn't even think about the cultural aspect. And so there are just so many different factors that come into play that I mean, I'm not a clinician, so I wouldn't know, but even me, I'm like, wow, there's so many different things that come into play here. So yeah, that's incredible. Thank you. Any final comments, questions, or thoughts from the group? All right, well, again, thank you, Amanda. That was wonderful. If you have anything you want to send to me, I'll distribute it to the group. The only announcement I have is that our next session will be on April 20th, and Anastasia Riley will actually be presenting for us on Positive Behavior Support Program. So I hope to see all the PBS CED folks back on here. We'll see you all next time. Thanks, guys. Take care.